What's going on? Boo, 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 boo. I apologize. I did not make a video yesterday. That's right. You didn't ask me anyways, but I didn't. And I apologize for that. Even though you're not sorry that I didn't. Anyways. I was just too busy. Alright? I was making music with Ray William Johnson and Breeze, the producer, and never got around to it. Sorry. Anyways, topic at hand is healthcare. This debate is apparently heating up, and there's a lot of misinformation going around. So I just thought I'd clear some of it up. And I know you want to win the healthcare debate, so I'm going to give you these are like talking points and shit, and they're fucking awesome. Number one is the fact that everything that's said against healthcare reform, reasons why we shouldn't have it, people who are anti-Obama's ideas, they're basically giving reasons of things that are wrong with healthcare now and saying they're going to be worse because of Obama's plan, which his are kind of to counteract those. You want out, kitty? Anyways, number one is the cost, and every single American that pays for healthcare now pays more because of health insurers. Health insurers offer zero healthcare. They don't offer. You want out, kitty? You want out, kitty? Huh? You want out? You want out, kitty? Okay. Bye. Anyways, health insurers offer zero medical care. Zero. They do not solve anybody's sicknesses. They do not give anybody medicine. They're not doctors. They do nothing. They are middlemen. And healthcare for America costs twice as much because they have to get their cut. Twice as much. They are the reason healthcare is too expensive for millions and millions of people. They are the primary reason why healthcare has doubled, tripled, quadrupled. It's gone up 25 times in the last 50 years. It's 25 times more expensive than it was. And that's because of the insurers. They are the primary reason for increases in the cost because they are for profit and they know that convincing the drug industry and the hospitals and the doctors, etc., to increase their prices means that they get a bigger cut. Now, they are totally and 100% anti-Obama and Obama's plan. Now, Obama, as far as I know, doesn't have an ulterior motive. He wants to cover people who don't have coverage, who can't afford it, etc., etc. Obama is smart. He is a bona fide genius. You do not want to be anti-Obama. If you are, you're stupid. You are less smart than him. There's no reason why you should doubt his reasoning. This guy has spent a good amount of his life thinking about this, discussing it. He knows what to do. He has a plan. You should go along with it. Or you can go along with the insurers who want to take your money and give you nothing in return. Now, number two, big myth, is that if there's a socialized healthcare, which Obama doesn't want to have socialized healthcare, that's a myth. But in the scheme of that myth is the fact that the health insurance industry as a whole will totally unravel if there's a government plan. False again, unless we're living in an alternate universe, because there is already a government plan. It is available. Millions of Americans already use it. And yet, the health insurance companies have not unraveled. We must be living in a quasi-universe where the thing they said would happen didn't happen, And they said it would. So they are lying. That is what's called a bold-faced lie. A projection on something would happen, cause and effect, that we know for a fact didn't. That's a lie. Nothing would happen to the health insurance companies. Number 3, and yes, there is already a government plan. The military uses it. The government employees already use it, and Medicaid old people use it, and also people on welfare. They also use it. And the government doesn't just pay some health insurance company to offer the coverage. They do it themselves because it is way cheaper. Way. By fucking far. You don't even want to know. Another fact is that, you know, these health insurers, it is huge business, and the majority of them are private companies to what I've seen on the internet as far as the stock prices and stuff. But you can check out Blue Cross Blue Shield. That's a big one, but it turns out that's a franchise. They have those spread out all across the country, so that's a huge network of people just spreading this propaganda. It's like thousands of companies. Each state might have multiple Blue Cross of, you know, New York, and this one Blue Cross of Oklahoma, whatever. And they're just spreading propaganda. Go to Blue Cross Blue Shield, bcbs.com. Because BC, you will see BS. You can go right on there. They have a link to, you know, an obvious propaganda website spreading false information and lies about healthcare. It's down in the bottom left. It's got a picture of the White House there. Anyways, so they're spreading the propaganda, and they're all doing it for the money, and they don't want the millions of people who don't have health coverage to get it. And it's not like car insurance or health insurance, health insurance is not like car insurance or house insurance, or it's not like car insurance, because car insurance, if you have a car, you have to have it. And if healthcare was the same way, then there would be some people that couldn't afford it, and they would have to have it anyways. And you know, that might be a good way to have it, because if you get in a car accident, you're covered by someone, somewhere. Someone has the car insurance. And it's not the same way if you get in an accident another way, or if you get sick, or whatever. And there's some people that believe that that's a right, not a privilege, that if you get some catastrophic illness and you need to take a leave of absence from work and deal with your sickness, that you won't lose everything you have, and you can return to your life after you get better. That's a fundamental thing, and I believe that. So yeah, go nuts. Argue about healthcare all you want. Peace.